Welcome to Parallax by Ankur, Kalra, a podcast produced by Radcliffe Cardiology to bring you a new angle of all things cardiology and the best from the US Cardiology Review. Published every second Monday, Ankur Kalra, MD, interventional cardiologist at the Cleveland Clinic in Ohio, USA, speaks with legendary cardiologists, reviews late-breaking trials, and interviews authors of our latest and best US Cardiology Review articles. We call them #audio articles. Parallax is the effect whereby the position or direction of an object appears to differ when viewed from different positions. So this podcast is your fix of reliable updates on all things cardiology by someone from a non-traditional background who is always looking at the industry from a new angle. Now, here's your host, Ankur Kalra, MD.
Hello, everyone. Welcome to another episode of Parallax. I have with me another great guest with us today. I'm sure she needs an introduction. The world of academic cardiovascular medicine, as well as industry, both know her really, really well. So I have with me Dr. Mauri today, Laura Mauri. She, of course, like I said before, needs an introduction. Dr. Mauri was, until 2 years ago, a professor of medicine at Harvard Medical School and an interventional cardiologist at Brigham and Women's Heart and Vascular Center in Boston. And then about a couple years back, she made a move to join industry. She is now the global vice president for clinical research and data analytics at Medtronic. So without much further ado, Dr. Mauri, welcome on the show, and thank you for your time.
Thank you, Ankur. It's a pleasure to join you today.
Great. So I'm sure the audience are very excited to have you on the show as well. And I would like to start the program by asking you about a little bit of your childhood and background. What were some of the influences during childhood that led you to pursue a career in medicine?
Mm-hmm. Yeah. So, I'll be honest, when I was a kid, I really didn't think about medicine immediately as something that I would go into. It wasn't something that was, I had a few people in the family who were in medicine, but nobody directly. So it wasn't something that I was really watching or observing. My parents were both immigrants to the United States from Italy and China. And so I always had a really strong interest in global work or languages. But I also had a love for science and mathematics. So there are a lot of different things that I thought about as a kid, but medicine wasn't immediately one of them. Science certainly was. And I really enjoyed traveling and living in different places. I spent a lot of time visiting family in other parts of the world, like Italy. And I also spent my high school years growing up in Tokyo, Japan. So those were really exciting experiences for me. So I imagined that I would do something that involves international work. It wasn't until later that I started to think about medicine.
That's great. Sounds like a rich childhood with experiences in Italy and Japan. Just sound wonderful. So when was it that you decided that you wanted to be a physician, a doctor, and then what was the path after you made that decision? What was the journey after that decision was made?
Yeah, so I came to the United States for college, and I went and I did my undergrad at Harvard in Boston, and so I had a number of different possibilities in front of me. But at the same time, I had a personal experience where my mother was ill with cancer. She was fairly young, and it came as quite a shock and a surprise to all of her family. And it was really through watching her personal experience with the healthcare system that I recognized a couple of things. One, just the value of that interaction between the physician and the patient, that just intimate relationship of providing support to somebody during a crisis. And then also recognizing, the significant unmet needs in healthcare and how they were supported by active research and advances in science. So it was that experience, I think, that really made me excited about getting involved in medicine at that time.
So after you made that decision, how hard was it to get in? I believe medical school was at Harvard as well. Am I correct?
Yes. Yeah, it was.
So, for someone like myself, who's a foreign graduate and an immigrant to the U.S., who came with, dreams set to at some point in my life and career, either be at one of the Harvard hospitals for training or, later on. And, I feel blessed and grateful and fortunate that I had that opportunity when I pursued my interventional fellowship at BI Deaconess in 2015, 2016. But, as someone, who came from abroad and did undergrad at Harvard College, how hard was it to get into Harvard Medical School?
Well, it didn't feel like it was a given at the time, I can tell you. I think nobody who's applying to medical school thinks it's going to be easy to get in anywhere. So it does feel quite daunting. If I look back, I remember not at all taking that for granted. So, I don't know. It's just something that you go through, right? So I was a biochemistry major, which I think gave a strong foundation at the time. And, I don't think it was just sort of being excited and I think passionate about what I was doing. That probably helped to get through the process.
Yes. And then, during medical school, when did you decide to pursue? Was it always that you wanted to pursue a career in cardiovascular medicine, or was it something that came on later in your training as an internal medicine resident? When did that transition, or when did that decision making happen?
Yeah, that's a great question. I just happened upon it, and I feel really fortunate that I did. No, I really hadn't had specific exposure to cardiology. And as I was going through, I went through all of my medical school training, with a really open mind. And I have to say, I really loved surgery. I also loved medicine, but I was very attracted to surgery, I think, because of, doing something with your hands, having a technical skill, seeing immediate results, having to be very precise about your actions. And I really enjoy that, as well as the acuity of the care that surgeons provide. But I love medicine as well for the complexity and in particular, I think when I was struggling with this decision between whether to go into one track versus another, I had the opportunity to do a cardiovascular rotation at the Brigham in the intensive care unit. And it was such a tremendous synergy of all the different things that I enjoyed doing. We're taking care of patients suffering from acute myocardial infarction. Many of them were being treated with novel therapies in clinical trials. At the time, they were thrombolytics. And I feel like I'm dating myself a little bit to talk about thrombolytic trials at this point in time. But so that was really exciting to see how, you could have something that had been on the bench, just years before, and you were testing out to see how patients that you were taking care of were doing, and you could immediately see results. And at the same time, I had wonderful supervisors in that setting, all the way from the level of the interns through to the attendings who were supervising, just people who were just so enthusiastic about what they were doing. And I'm still in touch with, I would say all of them to this day. And, when I think about that team and just the contributions that they've gone on to make in cardiovascular science and care, it's just pretty exciting. So it was just a tremendous time, I think, to be exposed to cardiology with that combination of new therapies, both in the pharma side as well as the device-based side, and then that immediate satisfaction that you get of taking care of acutely ill patients.
All right. So how was it? How was residency like at? And correct me if I'm wrong. Your residency was it also at Brigham and Women's Hospital in Boston? So how was it like to be a resident at Brigham and Women's? And perhaps if you could kindly describe, some of the experiences you had with some of the attendings at the Department of Cardiovascular Medicine at Brigham and Women's at the time that
Yes. Yes.
led you to pursue a career in cardiovascular medicine?
Right. It was a wonderful place to train as a resident, I have to say. I think the Brigham, first, we just had a wonderful cohort of interns and residents to be together with. People who really brought a lot of enthusiasm about what they were doing, but more than that, were really just nice people to work with. And so, it's wonderful to have that cohort of friends to this day. The Brigham, I think, is special because of the combined commitment to clinical excellence as well as research. So as residents, we had the ability to take a year off in our third year to devote almost entirely to research. But the first 2 years were very clearly committed to very intense, clinical work, just as you would expect. And so that gave us, I think, a great exposure to that potential for a combined career in clinical care and research. Through that exposure, I was really able to see a very strong cardiovascular faculty. When I think about being exposed to people like Dr. Brownwald and Dr. Pfeffer, Dr. O'Gara, at that stage in my career, as well as numerous other clinicians and esteemed trialists, it really had a huge impact, I think, in the way that I thought about the potential for my career to develop. And so you just saw the spectrum of, what we do in clinical trials and in research really impacts directly on the patients that we take care of day to day. And so those kinds of conversations were very fluid in between research and clinical care. And then in particular, for me, is I became more and more interested in, thinking about doing clinical trials work while I was there. And that was a switch for me because my background in the past had been in, as I said, in biochemistry and more basic research in immunology, vascular biology. But I just found the link between clinical research and clinical care to be something very compelling. And I saw it really embodied in the work of two people who became my mentors, Baim and Rick Kuntz, who are both interventional cardiologists, as you know, both of them who were at the Beth Israel before they moved to the Brigham when I met them. And you would just see them both taking care of patients as well as, thinking about clinical trials and rigorous study of medical devices as being very connected in terms of providing the best care for patients. So that was really inspiring to me, and that led me towards my future decision to become an interventional cardiologist.
Okay, great. As an interventional fellow at the Deaconess and Beth Israel Hospital in 2015 and 2016, I obviously heard a lot of stories, rotating through that lab. But it is very heartening to learn from you as well as to, what really influenced your decision as a fellow in general cardiovascular diseases to then pursue a career in interventional cardiology. But tell us more about that relationship. This is probably some great trivia, but tell us more about how was it like to actually work with Don Baim, and also to work with Rick Kuntz. I'm sure the audience would love to listen directly from you.
Yeah. I think working with Don was great. As you probably know, Don wrote a textbook on cardiac catheterization together with Bill Grossman that is still a classic. And I remember reading it as a fellow, just starting out in the cath lab. And you realize as you're reading that, but even more so when you worked with Don, that he did everything for a reason. There was always his experience but it was always very logical. He was just super logical. And it was just a great way to approach things, that there was often a good way of doing things, and he had figured it out by trying out all the other ways as well and comparing them. And so that kind of very analytical approach, I really respected. Seeing that, in one person you could combine having somebody who was just very thoughtful and scientific together with somebody who was actually able to do a great job, from a technical perspective in the cath lab, and bring those two things together. So he was great to work with, a great role model, had a wonderful sense of humor. And I think in particular, as a woman in interventional cardiology, there was just never any question about, whether that was going to be any different for me than it was for any of my other compatriots going through the process. He was just as supportive, and very strongly so. So I think he was a tremendous role model to work with. And Rick very much so, as somebody who trained with Don, brought that similar sense of humor and combination of both, very critical scientific thinking together with real care for patients, real dedication for patients. So it's nice to see that, because you don't, they're just, I think that's exceptional for people to be able to bring those skills together.
Yes. And I agree. I mean, it's tough to excel in both realms, of clinical care of patients, as well as, clinical investigation. And I believe there are many, like myself and several others who've looked up to careers like that of yours and Bobby Ye, to emulate, because you both sort of exemplify excellence in clinical care as well as clinical research. So for the fellows in training, and also for early career interventionalists, like myself and several others who are our audience, what are some of the recommendations you would give to develop a career being mindful of taking care of both aspects? Because it is according to me, I think, and I've thought about this day in and day out, is you have to be deliberate about it. You is what I think. Because your career in clinical investigation could totally take a backseat as clinical care comes to the forefront, and vice versa. So I do think there has to be a fine balance, but is challenging, and in my experience is a very conscious decision on a daily basis. But I'll obviously want to hear more from you.
Yeah, I agree. I think it may be even more challenging now than it was when I was a clinical fellow, and in my early career. I think I was very fortunate to have started my career in the environment that I did. I mean, I think of one, having excellent mentorship, and then two, having a great environment. And I think it's important for especially for an interventionalist or a proceduralist, if you're going to combine these two things, you really want to devote yourself 100% to both of them. And I know that you don't have twice as much time as anybody else, so you don't really have the time to do that. But my point is that you want to approach them with a similar level of intensity. So the only way that you can do that is to really prioritize what you choose to do within each of those spaces. So, you do have to make choices. And I remember, thinking about how diverse of a practice in interventional cardiology I should develop. And I at the time, the big growth area this was before transcatheter valves, was really in peripheral arterial disease treatment. And, I would have been intrigued to do that clinically, but I knew that I wouldn't be able to do everything that I wanted to do in clinical research. And then later on, I had to make the choice of, yes, I was involved in developing trials for transcatheter valves, but did I have a time in an early career and as well as in an early device development time to invest the time that the patients would need in that space to do both. And so I made a decision to stick with, complex coronary intervention is my area of specialty with the cath lab. So you do have to say no to some things. And then likewise on the research side, I think I always thought about choosing to do things that were really worth the time, and not saying yes to everything, but just being as judicious as you could be with your time. But then once you chose, then to really dive into things with 100% effort, so that you could be successful. And I think the reason the environment makes such a big deal there is that I think you need to be in an environment that supports you to do that. And the way that they do that is, it's not just to say that, you have dedicated time for research, but on the clinical practice side, it has to be a setting where you feel it's high quality and a high volume place, so that you can stay excellent at what you do, or develop your skills early in your career.
Yes. So let me ask you another question as an extension to this answer, which was an excellent answer. Is you mentioned about choosing wisely, and the path you want to take in your career. Is that decision based on what's in trend or what's trendy versus something that truly interests you but may not be as trendy? For example, I'm just gonna give you an example from interventional cardiology, and that is, transcatheter valve therapies are very trendy, and even within, for a reason. I mean, obviously they're exciting developments for the field, and there are a lot of procedures under the rubric of structural heart interventions which are now being performed. I think within the realm of structural heart interventions, you have, obviously the aortic valve, but also mitral and now tricuspid. And the way the field is moving, there's a lot of clinical investigation happening in the tricuspid space now. But if someone is not as interested in tricuspid and remains interested in aortic interventions, should someone then consciously decide to pursue versus not pursue tricuspid? I'm sure you understood the point I'm trying to get at, and that is, should the decision be truly based on what truly interests you and catches your attention, and versus something which you may foresee or think is going to become quote unquote trendy?
Yeah, well, that's a complicated question. I don't think there's a simple answer to that. I think you can't be stuck in the past. Obviously, you want to be thinking about where is the field going, but you also don't want to be a follower where you're simply doing what everybody else is doing. So I think it's a combination of being passionate about what you choose to do, being convinced that it's the right direction, even if not everybody's following, and then but also being mindful of what the trends are, so that you're not getting left behind. So I think it's a balance. I mean, ideally, you are anticipating where things are going so that you can develop your career in that direction. But it doesn't mean that there's one way that's best for everyone. I mean, there's obviously a great value to being the specialist in a specific area where there is limited expertise. And I think that one way of doing that is by making connections across different areas that others might not have seen. So that could be, when I think about, new areas like transcatheter valves, more generally bringing together surgeons and cardiologists who are learning each other's areas, bringing that together with cardiovascular imaging. The same kinds of principles are true for other areas, thinking about renal denervation in the future and how that requires new ways of thinking from both interventional cardiologists and hypertension specialists. And then on the research side, a lot of what I thought about was how do we take, advanced methods that statisticians are thinking about and then apply them to the questions that are relevant for clinicians. So I think you don't necessarily have to follow, but you do want to identify what the urgent needs are, and then maybe bring your own unique solution to those.
Yeah, well, excellent. So, which brings me to your years at Brigham and Women's, where you obviously led several important studies and rose through the ranks to become professor at Harvard. Now, how were those years spent? Looking back, I know it's only been less than a couple of years, but what are some of the memories you reminisce from that time? Because I think you spent several years, like as a trainee, as a med student, then as a trainee, and then on faculty at Brigham and Women's Hospital. So just if you don't mind walking us through those years.
Yeah. Well, yeah, I think of the Brigham very fondly. You're right. I was there from my medical school rotations all the way through until 2 years ago. So my whole medical career, essentially. So I am very fond of the hospital. I think it's really the people that you remember the most, the teams, and not just the physicians, but all of the staff that you work with day in and day out. The fact that you can, walk into a procedure room and people know you and they know your family and they know, they know about you, and more than that, that you can walk into an acute setting and take care of the patient. And then, we had our share of challenging things that happened within the hospital with, one of our colleagues, Dr. Davidson, dying prematurely, within the hospital. And that was a really traumatic event that we all went through together. And just the way that people pull together in those situations, they just really stick with you. I think there's no place like being in a hospital for years and years and years for developing those kinds of intense relationships.
And then what are some of the most, I think, probably most favorite, or memories that you're fond of as a mentor? Because I'm sure you mentored several residents and fellows who, pursued training, both clinical and research training at Brigham. How was that experience for you?
It's great. It's wonderful to see people progress through their career, and people make their choices throughout. So I think, watching people's careers evolve. Everybody makes different choices of where to go with their work, but seeing the satisfaction that comes from those choices is really exciting. And it really, it takes years to see that play out. So it's really a long-term investment of time to support that. And then that interaction with a mentor, I think over years, you mentioned Bobby Yates, and he's obviously a star example, and now a well-known investigator to everybody in interventional cardiology for sure, and beyond that for outcomes research. But remembering, from working from him when he was just developing and choosing how to proceed with his career as a fellow through the time period of trying different research methods, and then eventually moving on to run his own outcomes research center at the Beth Israel Deaconess Center. It's just very exciting to watch how quickly a career like that can develop.
Yeah, and if Bobby is listening, I'm not sure he is, but as someone I've tried to look up to and emulate, my career path, and I'm sure at some point I will have him on the show as well. But coming back to your career, so about 2 years ago, you decided to to transition to industry, which I'm sure was a decision that came in with a lot of thought. So a couple questions, couple follow-up questions to that is, one, how's the transition been for you? But before you answer that, what were some of the pivot points at that point in time in your career where you decided to leave medicine? I shouldn't really say you left medicine. I mean, you're still doing a lot of things to improve lives and impact patient care, through innovation and analytics and research. But what was how was the decision? Was it a hard decision to leave a prestigious institution like the Brigham and Women's and an academic appointment at Harvard Medical School and join Medtronic?
Yeah. I mean, on the one hand, I was always being exposed to the role of industry in advancing medicine. Because as you know, working on clinical trials, I was always working with new devices from an early stage through to the pivotal trials, and then using them in practice. So I knew that I enjoyed supporting that process from an academic perspective. I think what I valued as an academic was the ability to work across multiple different companies and areas, and have really the ability to give a very I guess independent thought to how to proceed with different choices, whether it was for early stage device or how to conduct a study. And so I really enjoyed that part of my work. At the same time, I realized that was like a small slice of what is done in industry. And I think at a certain point, I felt that I had contributed and had the impact that I wanted to have from academic medicine, but I wanted to continue to expand how I could have impact in medical technology and really expand, my own personal way of contributing to that. And so it has not been a difficult transition. Actually, it's been really pretty seamless. I mean, I wouldn't say it's easy, because it's very exciting and challenging and stimulating to be working in a new environment. It's very different working in a company than it is working in a hospital, for example. And the work is even more global. Even though I obviously worked with international investigators before, I think it's very interesting to see how we provide access to therapy across the world. And then also, how do we work beyond cardiovascular? So Medtronic, as you know, has products in diabetes and spine and many other areas that are outside of cardiology. So really thinking more along the lines about how do we generally support better research to allow access to new therapies in the future. So it's been very exciting, but also I don't think I've had any regret or any looking back and saying, gosh, I wonder if I made the right choice. It's been very fulfilling.
No, that's great to learn. So what is I before we end the segment, I wanted because I have this opportunity of having you. What are some of the advice that you would give to early career interventional cardiologists, or just early career cardiologists, or even fellows in training, who want to pursue a career in clinical investigation, who want to pursue a career at some point with industry? Do you think these decisions come with time? Do you think or these decisions should be made upfront, or I'm sure it's different for different individuals, and each one of us have different priorities and dreams and what we want to fulfill, or what we want to do to have a fulfilling career. But what are some of the advice you would give to early career investigators and clinicians?
Mm-hmm. Yeah, I think it is very individual. there are people who go into industry after they get their medical degree, and then there are others who leave their careers, fairly after they're quite established, and still have a lot to contribute. And I think what you contribute is different based on the experience that you've gained. But it's not just what you bring in; it's also the kind of the track that you have in front of you to continue to contribute. So I don't think it's better or worse to make a transition early or late. I think it's really, I would say, if I had to put my finger on what matters, it's, where are you going to have the most impact with the skills that you have right now, and then over, the near term of your career. It's harder to project, your entire career in front of you, but just thinking about, are you having an impact now? And could you have a bigger impact with a career change? Those are some of the things that, I thought about when I thought about the transition, that I think are probably relevant at multiple points in your career.
Great. Well, Dr. Mauri, it's been my absolute honor and pleasure having you on the show. Thank you for making the time to talk to us, and I can't wait to share with you the response that we've had from our listeners, on social media and also different podcast platforms. So thank you again. Thank
you, Ankur. It's fun talking with you. I appreciate it.
Dear cardiologists, we want to make this podcast about you and for you. So please email us your critical thoughts, comments and questions at podcast@radcliffe-group.com and visit uscjournal.com for more information. You can also follow us on Twitter, LinkedIn, Facebook and Instagram at Radcliffe Cardiology for daily updates. Join thousands of cardiologists and become a Radcliffean by registering to radcliffecardiology.com. You will receive regular newsletters and gain access to hundreds of expert interviews, educational webinars, clinical cases, and peer-reviewed articles from our 6 medical review journals on general cardiology, interventional cardiology, arrhythmia and electrophysiology, cardiac failure, and vascular and endovascular surgery. Thank you.